Are you someone who feels like your eyebrows are naturally quite low? Or you might be a little bit older and your eyebrows, which were high, have now come low. You're wondering what to do about it. Can you do a brow lift? What are the types of brow lift? What are your options? To discuss all of this, I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center for Aesthetic Health, Bangalore. Now, a brow lift is the name of the procedure done to lift the brow. It's quite simple. What causes a low brow? Well, two main reasons. For some people, they naturally have a low brow. What do we mean by a low brow? An eyebrow naturally should have an arch. The inner 2/3 should be going upwards and the outer 1/3 should come downwards. So this is the normal eyebrow arch. In some people, this arch does not exist and the eyebrows are quite flat. So there is no upward angle, it is just flat and then it comes down. This can happen by genetics. Some faces are naturally like this. The other more common reason is it happens as we get older. A higher eyebrow is a sign of looking younger. As we get older into our 30s, 40s, 50s, 60s, the eyebrows start coming down. Particularly in some cases, they can come really low and they can make you look quite old and tired. Apart from looking tired, they can also affect your vision. By bringing it down so low, they can also cause a droopy appearance of your upper eyelids and you might feel like you're not able to open your eyes fully normally. So how can we improve this? There are lots of options. You have surgical options, you have non-surgical options. Let us start with the non-surgical options. Non-surgical options are basically two options, a chemical brow lift and a thread lift. A chemical brow lift is using Botox to lift the eyebrows up. This is done by injecting Botox into the inner part of the muscle here. Everyone has a muscle here that lifts the eyebrow. It's called the frontalis muscle. When you lift our eyebrow like this is the muscle that is working. So when we do Botox, what we do is we relax the inner part of this muscle so that the outer part works extra and that pulls up the corner of the eyebrow. This works well to a slight extent. It can give you a slight lift. So this is good in people who are quite young, 30s, who just want that little bit of a lift in their eyebrow. It is not good as you get older. The second non-surgical option is to do a thread lift. This is where we use threads to lift up the eyebrow. This is a non-surgical procedure wherein we make a tiny hole, put these threads in and that lifts the eyebrow up. This looks very good when you do it. It looks amazing, but it doesn't last very long. Typically, it lasts for anywhere from 6 months to 1 year. So again, this is worthwhile in your 30s and your 40s when again your eyebrow lift required isn't very high. Now we come to the surgical options. The surgical options are required when your eyebrows are really droopy and they need to be lifted by a bigger amount. There are two ways in which we do this. One is with a blepharoplasty. So in some patients, when we're doing a blepharoplasty surgery in their upper eyelid, through that same cut in their upper eyelid, we also go underneath the brow and we lift up the brow and we use a stitch to keep the brow in this high position. This again gives a modest improvement. If someone doesn't require a very big brow lift, this works quite well. And in a lot of people, blepharoplasty is anyways being done, so this is a good thing to be done at the same time. If you want to know more about blepharoplasty, you can watch our other video on blepharoplasty. The final option is a proper surgical brow lift. Before, this used to be a very big surgery. They would literally make a cut across your forehead like this, lift up the skin, put it down, remove some skin and stitch it up. That means a big scar in this area. But thankfully, things have evolved and we no longer do it this way. Now what we do is we make tiny holes over here and here, each around 3 millimeters. Through these tiny holes, we lift up the skin of the forehead, lift up the forehead, put it in its new position and we fix it. We fix this using these kind of external sutures called a hemostatic net. You can see that photo here. I know, it looks quite scary. These stitches are removed within 2 days. Early on, you might see a few small dots there, but with time, this fades away. This gives a very good result and the result is long lasting. So how is the surgery done? This surgery is done typically under general anesthesia, but it can be done under local anesthesia as well. It's a daycare procedure. You come get it done, go home the same day. You feel pretty okay the next day itself. As I said, those external stitches, we remove them after around 2 days. Those few dots that are there, that dot-like appearance might be there for around 1 to 2 weeks. You feel pretty good within 3-4 days. You can work on a laptop, work from home within 3-4 days. For you to go outside and show your face and people not to know that you've done something, that might take around 2 weeks. How long does this result last? Well, a proper surgical brow lift result can last you many years. Initially, it might look a little extra, like the eyebrows are too high. Then as time goes on, it relaxes and it becomes a little bit more natural. Let us now look at some results of brow lift surgery. You can see them here. So I hope this explains your questions. As you can see, there are many options. To summarize, non-surgical options are good when you're a little bit younger, 30s, maybe 40s, when the amount of brow lift needed isn't very much. Surgical options are required when you're a little bit older and the amount of brow lift needed is more. When you have really low brows and they need to be brought up properly, there is no compromise, there is no substitute for a proper surgical brow lift. I hope you like this video. Do share and subscribe. Thank you. Have a great day.